Just want to give you guys a little introduction. My name is Dr. Akiba Green. We're all here to talk about weight loss. It is the new year. This is, obviously the time when everybody starts thinking about their body and what they're going to do. But what we're going to do tonight is we're going to talk about weight loss from a little different perspective. My approach is not to give you a fad diet or to give you HCG injections or Medi weight loss or any sort of these quick fixes that are out there. We're going to talk about how your body works, why you're having trouble regulating your weight properly, and what we can actually do to correct it. So, I want to give you guys a little background on myself. Now when you came in here, my name again is Dr. Akiba Green. You saw there's two big signs above. One said Integrative Health, one said Chiropractor. I love talking about why I'm a chiropractor when we do these workshops. This past weekend we were at the Fitness Expo. I did a workshop on autoimmune disease. We do workshops on thyroid very frequently. That's one of really the bigger conditions that I treat in this office. Peripheral neuropathy, irritable bowel syndrome. And really it's why is a chiropractor doing all this metabolic talk, doing stuff that's really more of a medical thought process when you think about treatment. And first, it's really not so much of a stretch. When we talk about what my background is, when we talk about basic chiropractic, my entire profession is based on a drug-free approach to whole health. More specifically, I have gone through several specific fields of study. I am board certified as an integrative medicine practitioner. I am board eligible as a clinical nutritionist. That means that I've gone through over 600 hours between those two programs to further my education. I am involved with an organization called A4M, it's the Association for the Advancement of Anti-Aging Medicine. All those medical clinics that are out there that do anti-aging injections and the pellets and all that menopausal type, it's take the testosterone, the progesterone, the estrogen pellets. They all learn from this organization I'm a part of. And I'm not doing that study. What I'm actually involved with is the only fellowship in the country that's associated with integrative cancer treatment. It's actually through the University of South Florida Med School. This is a really remarkable program. It's backed by the AMA. And it's an approach to treating cancer patients from both a supportive and an alternative perspective. What this has done, what the studying that I've done over the past 4 years has allowed me to do is have the knowledge to help my patients get better. Last year I hit 308 hours of continuing education alone. It's a lot of time, a lot of money away from my friends, my family, my daughter and my wife, and my office. And the reason for it is so I can come here and teach you guys how we're going to succeed with your health. There's two names I want you guys to know. The first name is Dr. Michael Johnson. He's one of the top integrative practitioners in the country. He's an autoimmune specialist. He's in Appleton, Wisconsin. The other name is Datis Karazian, Dr. K as he's known. Dr. K has several books. The book that all my patients end up usually reading is Why Do I Still Have Thyroid Symptoms When All My Lab Tests Are Normal? It's a great, great book. When we talk about weight loss, it'll ring true to possibly some of you as we get deeper into looking at lab work. But really, these two docs are doctors I've trained under. They're my mentors, they're my teachers, and a lot of what they've taught me, a lot of what they preach really helps us get a better understanding on how your body works. And what we do is we practice functional medicine and functional neurology in our office. It's this integrative approach that looks at the whole body. With that being said, I have 3 goals for you tonight. And when I do these, I really want to make sure we cover all 3 of these goals because they're really, really important. Most importantly, number 1, I am here to reinvent your life. The average lifespan in this country is 74 years. So if we talk about where we are from 0 to 74, I'm right here in the middle. That is something in the realm of, I think it's 2,000 weeks left to live. Okay? You think about where you are, good evening, come on in. You think about where you are right now in that lifespan. How do you want to live those 2,000 weeks? Do you want them to be better? Do you want them to be worse? I'm here to help reinvent your life and give you that chance to improve the remaining weeks that you have left. Number 2, I'm here to add maximum positive impact to every human being that I come in contact with. This weekend we had a chance to touch 34 lives when I gave my lecture. We're on YouTube. We've got over close to 12,000 views on YouTube. What I do is I'm here to help you guys learn more about what we do, and it's by educating you. and it touches your life hopefully in a positive way with that. Number 3, most importantly, for all of you here today, I'm here to give you an exit strategy. What can you do starting tonight to start losing weight, to start changing your health? When we talk about frustrations with weight, how many of you have tried diets? Sure. Yeah, you know, and you end up gaining back more weight than you lose. You know, how many of you have been told you're lazy, you got to exercise more, you got to eat less? I mean, you know, you go to the doctor trying to, you know, you go and you know, your family doesn't get it, nobody gets it. You tried to do what you're told to do. You said, hey, this is the right thing, this is how you're supposed to lose, just exercise more, and nothing works. If we believe that exercising more and eating less is the way to diet, then why doesn't it work for every one of us? And we all know the skinny person who can eat as much as they want. And we all know somebody who eats next to nothing, exercises all the time. You know, we're talking about patients that will come in and say, you know, I'm in the gym 6 days a week for an hour and a half a day, and I can't shed the pounds. All my friends, you know, you do a Biggest Loser competition, and 10 of my friends all lost 30 pounds, I lost 1 pound. And we've all heard it, I mean, we've lived it. There's a reason why this happens. Now, if you're overweight, you're not alone. I mean, our country, we talk about America for a second, 34%, 1 in 3 Americans is obese. 17% of children, 1 in 6, are obese. 66% of adults, 33% of our children are considered overweight. The ratio of obese adults has doubled since 1980. And the scary thing is the rate of obese children has tripled since 1980. We are not a healthy country. And before this presentation, when you were being told you were overweight because you're not doing enough. But I'm here to tell you that's not true. That's incorrect or false information. Much of that bad advice comes from the very people who profit the most from you being sick and overweight, if we really think about this. Now, I'm going to give you guys some examples. Again, we're going to talk about some common mythologies that are out there when it comes to what we eat. I'm going to start with grains. Wheat, rice, corn, bread, cereal, pasta. We've been told that they're the stuff of life. We've been told that the U.S. government recommends 6 to 11 servings a day. Provides the main source of energy for us as we're going throughout the day. Whole grains are better. Gosh, this morning I heard on it was either Today Show or the radio, I forget which, but they said that was one of the biggest scams that they said was whole grains basically mean white grains with some stuff added on top of it. I mean, it's just, and what science really says, and this is the thing, what science really says is that when you eat grains, it drives insulin, excess insulin production, which actually will increase fat storage and lead to diabetes and heart disease. Immune suppressing grains. 1/3 of the U.S. population cannot digest grains properly. It's going to cause your immune system to attack. We talk about gluten. We'll touch on that one a little bit later. But that's a huge issue that we're seeing, and you can't go anywhere without hearing something about gluten-free. You know, and why is it affecting so much more now than it did 20 years ago? How about whole grains are possibly worse, again, not only because of maybe they're not really that healthy as far as how they're produced, but more importantly, the whole grain could potentially mean more inflammation. It's pro-inflammatory, and it can actually impact your immune system more. Your digestive system has to digest it. It's harder for your body to digest. There's a reason when our pets are put on a strict diet, it's white rice, because it's easy to digest. If we talk about whole grains, it's harder for our body to process through, especially if we talk about the excess fiber. Now, how about saturated animal fat? What we've been told is to limit our intake. We've said, hey, it can increase the risk of heart disease. Eating meat makes you fat. Replace saturated fats with polyunsaturated fats like vegetable oils. Science does not agree. What science really says is there's little or no association with heart disease and fat intake. And again, if we talk about that, there's 2 studies, the Framingham and the Nurses Health Study, which was a British study that were huge, that really pointed to that. Fat should be a major dietary calorie source. Actually, fats and protein should be where most of your calories come from. It helps promote efficient metabolism. Weight will actually come off when you eat good fats. It gives you better energy levels. There's actually a product, none of you probably are on it, you know, it's something that you're only going to see really with the football players, but it's called muscle milk. And you may have heard of it, your kids may have had it. It's actually, it's like a workout shake, okay? It's not made from protein. It's not made from carbs. It's actually medium chain fatty acids. It's fats, the entire thing of that. And this is actually a whole field of sports medicine for people to help build muscle and burn weight by using fats. I mean, so even in the supplements that you're seeing, that's what they consist of. Now, a major risk for heart disease is actually something called metabolic syndrome. It's also called Syndrome X, and it's driven by excess polyunsaturated fats, low omega-3 fatty acids, your fish oils, and high carbs, or really carbs that drive insulin to go up. And then, of course, the stressful lifestyle. So if we really want to talk about where the problems come from, it's not from eating animal fat. How about cholesterol? It's another one. Strictly limit your intake. Does anybody here know what cholesterol does? So how weird is this? So we've got, again, the 5 of you, and yet we know that cholesterol drugs are the #1 drugs that are advertised on TV. We know that we all know that we're supposed to keep our cholesterol down. Yet none of us is told what cholesterol even does in our body.
That's critical.
Yeah, it is. The first thing that cholesterol does, just so you know, is it actually helps your body produce all of your sex hormones. If your cholesterol is too low, you can't make estrogen. You can't make progesterone or testosterone. It also helps all your nerves and cells function and communicate with each other. Cholesterol is vital for our body. Now, we're told that if you elevate those levels, it increases heart disease. Take statin drugs to lower those levels. Eliminate animal fats to lower those levels. We're told 200 is the cutoff point. You guys ever heard of the World Health Organization? It's, sure, it's like the world's body on health, okay? It's the UN does it. They had a study that was literally published probably 6 weeks ago. The ideal cholesterol for not dying. A worldwide study, what cholesterol level did people live the longest? 240. Not 200, not 160, but 240. In this study, it's really kind of interesting to see how it hasn't hit more in the press here. And you really got to start wondering if the World Health Organization, if the UN is saying 230s, 240s, these levels that are higher are where we should be, and we're not talking about it, who's controlling our media outlets? And I'm not going to go there really with this, but if we start talking about that, I mean, we know that's a reality. And the key thing is, the worst thing is, if you don't have cholesterol that's high, still take a statin to avoid it if you have a family history of heart disease. Now, we know that cholesterol, again, is an essential metabolic nutrient. We just talked about what it does. There's little or no relevance to heart disease and cholesterol. In fact, if your cholesterol levels are below 300, there is zero link to an increased risk of cardiovascular disease or stroke. Above 300, there is a risk. And again, that same study, the Framingham and Nurses Health Study, points towards that. It's only dangerous when you get inflammation in your body. Now, our blood vessels have something called the endothelium. It's the inner lining of our blood vessels. And what happens is inflammation or oxidative stress will cause damage to that blood vessel. That inflammation creates this little damage that has to be healed. The body is going to use cholesterol to heal it. That can potentially lead to blockages. But whether your cholesterol level is at 130, 150, or 300, the body's only going to use how much it needs to heal. It's not going to use more or less. So the damage isn't cholesterol. The damage is inflammation, and you have to figure out why that inflammation is there in the first place. Statins have disastrous side effects. We're talking neuropathy, myalgias. You're talking, again, it can lead to all sorts of problems. We lose energy, we have sleep issues. I mean, statins are not really good, and very minimal direct benefit. Again, you talk about, is it really going to be beneficial for you to go from 210 to 180 in your cholesterol level by taking this pill that does all this damage to you? No, it's not. Yet it's what we're told to do. How about eggs? Minimize consumption due to high cholesterol content. So this goes back to the cholesterol issue. Eat just the white as a high protein alternative. The reality is the yolk is extremely nutritious. That's where all the nutrition is. And there's, again, very little correlation between heart disease or cholesterol levels in actually eggs. In fact, we all know people who say they can eat 15 eggs a week and their cholesterol is perfect. Why is that? It's because cholesterol isn't the problem. Eggs aren't the problem. There's other risk factors that are going on with your body that contribute to it. Fiber. Now, we're all told to have a certain amount of fiber as our dietary goal. It's mostly, where do we get it from? Grains. And it supposedly improves our GI function, it lowers cholesterol, it's going to speed elimination, it's going to help liver function, it's going to control blood sugar, it's going to help weight because of the caloric intake. Again, the problem is incidental fiber from fruits and vegetables is good, but there are two types of fiber. There's, if you will, good fiber and bad fiber, soluble or non-soluble. And excess fiber from a grain-based diet is going to clear everything out, not just what's bad, but what's good as well. It'll actually hamper GI function. You're going to see more problems with nutritional deficiencies derived from it. So where's all this great advice led us? In 1997, the U.S. ranked 34th in the world in healthcare. In 2000, we were 37th. In 2007, we were 48th. In 2009, we ranked 5th. The U.S. ranked 41 in life expectancy in 2009. We spend more on healthcare than any other country, yet we are really one of the sickest industrialized nations in the world. And we all know that, we've all heard that. And it's because what we're being told is not correct. And you talk about these health statistics. 1 in 4 will die from heart disease. 1 in 4 will die from cancer. 1 in 3 will develop diabetes. 1 in 3 women are depressed. 1 in 6 couples are infertile. 1 in 6 kids have a neurological condition. 1 in 8 people has an autoimmune disease. 1 in 8 women has a thyroid disease. These are all chronic diseases. We've never been sicker than we are now, and we've got to talk about why we're getting there. You know, something that is definitely wrong with the advice that we've all been following if our country is on the wrong path. You know, it's my real belief that this healthcare issue that we're in, and we talk about the healthcare changes that are coming, are going to, they are going to increase access to healthcare. But until something is done to actually change the way the quality of this care is, these statistics are going to keep going. We're not going to get any healthier. You talk about the food pyramid. 2 years ago, you know what they decided? Pizza was considered a vegetable in schools.
Oh, good. I feel better. I eat a lot of vegetables then.
So if you think about it, how nonsense is that? Pizza's junk food. We all know it. Whether you eat it or not, we know it's junk food. We know it's not good for us. Schools made it a vegetable because of the tomato and the vegetables that we're talking about, so they could qualify it in that food pyramid. And they could actually give it to the kids. That's a shame. You know, this food pyramid needs to be turned upside down. It's completely wrong. I want you guys, if you can, to write something down. The advice that you've been given is wrong and it's making you unhealthy. You have a problem with your weight because you're unhealthy, not the other way around. You're not overweight because of health. Health is creating the weight problem. And you have to improve your health if you want to lose weight and keep it off. You need a doctor who will work with you to find out why your body isn't functioning the right way. What's causing you to be unhealthy? I am that type of a doctor. What we're going to talk about is our program tonight and what we do, and I'm going to walk through this paperwork we have. We're going to walk through how we help patients differently. Now, this is not a typical one-size-fits-all program. What we do is not about intense exercise. It's not about starving your body. It's not a quick fix. Like I said, there aren't prepared meals. There's no calorie counting. What we're going to do is find out why you're unhealthy. We're going to look at your metabolism and work to fix it, allowing your body to speed up and lose and burn that fat normally. I'm going to teach you how to make the right food choices. What should you be eating for your body? What are we going to do to return your life to you to the life that you deserve? If you turn that off, the far switch.
Okay, it's paper vertigo.
Yep. Yep, that's fine. Absolutely. So obviously with weight, we have more than just weight going on. We know that there are multiple issues that we're dealing with. So, you know, again, you have to be willing to change your current habits. This is the key thing. You have to be willing to change what's going on with you. You got to take responsibility for your health. Nobody is going to do this but you. Now, you need help and you need guidance, but you have to be the ultimate one. I cannot care for you more than you care for yourself. So why are we struggling to lose weight? Let's talk about this. You're all suffering from something, and I want you to write this down on the top of page 1. Web of physiological dysfunction. None of you in here has just one thing wrong. Physiologically, it's impossible. That web of physiological dysfunction, when I talk about that, what I mean by that is you have multiple things that are impacting your body. It looks kind of scary. It looks very confusing. We all have liver problems, hormone problems, thyroid problems, gut problems, adrenal issues, blood sugar issues, cellular dysfunction, DNA and stress, brain involvement, mind-body issues, emotional issues. They're all involved, And all of those things are contributing to why you have the symptoms that you have. All of you may have brain problems, and we're going to find out in about 20 seconds. You all have nerve problems. You all most likely have a thyroid problem. You all have gut problems. Talk about short-term memory. Your metabolic health is not where it should be, or you wouldn't be here trying to find answers. And all of this is going on with your body. And they don't make a pill for this kind of a problem. You know, we're going to talk about your web of dysfunction, and we're all going to write down on our paper our own web, or actually I'm going to have you guys follow along. But before we do that, I talked about the brain. I said, you all have brain problems. You're kind of thinking, what are you talking about? So I want you guys to go to page 4, the last page in your packet. Now, most of you filled this out. If you didn't all fill it out, that's okay. So when you look at this page, the one with all the yes and no's.
Oh, yeah, again and again.
We're going to talk about 3 parts of the brain. The first part we're going to talk about is something called the frontal lobe. Now, the frontal lobe, talk about your brain, is where all of our personality exists. Our executive function, what makes us us. If we've noticed depression, anxiety, irritability, other changes occurring, it's occurring in this part of the brain. The frontal lobe is where that's happening. How about the hippocampus? The hippocampus is where all of our memory is stored. If we have problems with our memory, if we have brain problems, you have a problem here. The third area is the parietal lobe. Now, the parietal lobe is where all sensory input fires into the body. So, does anybody here deal with pain or achiness or even tight shoulders, burning, numbness, anything at all? So if you're dealing with pain, I'm going to use the analogy of a condition called peripheral neuropathy. Okay, this is burning. It's sometimes associated with diabetes. It doesn't have to be. Thyroid dysfunction causes it. It's something that a lot of people actually deal with. Some 20 to 27 million Americans have this problem. If you look at your feet, the patient's going to say they're burning. But you're going to look and they're not on fire. The reason they feel like they're burning is because the part of the brain called the parietal lobe is malfunctioning. And it's creating the sensation of heat in your body, trying to tell you something's wrong. It short circuits, and we develop pain or numbness as a result. All pain of any type comes out of the parietal lobe. So again, how many pills are there to fix your parietal lobe? Honestly, none. They've tried. It's called gabapentin or Neurontin, Cymbalta, Lyrica. These drugs don't work. Most patients who come in, the doses, they start, they say they feel great, and then a few months later it wears off. They have to increase the dose, and eventually they're taking such a high dose, the side effects are so much, and they still feel the pain. It's a no-win situation for them. If you have short-term memory loss, again, there's no pill that's going to fix your short-term memory bank. So when we have your brain, if we look at this form, it controls every function in your body. And if you have more than 5 yeses on this page, you have a brain problem. We know it's not functioning properly. What the brain does is it sends a signal, an electrical signal, down your spine. That electrical signal goes everywhere. If the brain is malfunctioning, it sounds like some of you may have a brain that's malfunctioning, it can affect every part of your anatomy. Nerves go to your organs. They go to your extremities. They go to your spine. They go to your thyroid. They go to your gut. They go everywhere. And if you don't believe me, we're going to look at the metabolic assessment forms that you guys have to talk about which organs are malfunctioning and to help uncover your web of physiological dysfunction. So we're going to start actually with category 1. How many doctors have you been to for your weight problem who looked at your colon to see if it was causing your weight? Yeah, it's probably very little. You know, so category 1 is your colon. And when you look at, we're on page 2 now. If you look into your packet, it's the section that has section up top that's got your list your problems, and then it's all the categories that go from 0 to 3. So here's how this works. If you have any 1s, 2s, or 3s in category 1, you have a problem with your colon. Category 2 and 3 is stomach acid. Excuse me, stomach, just in general. And, you know, again, we talk about stomach acid being key for proper nerve function. If anybody has concerns with osteoporosis, calcium is digested in the stomach. So if we have bad stomach acid levels, we're not going to digest calcium properly, and it's not going to be used. Reflux, GERD issues, there's an infection called H. pylori that can oftentimes associate with that. And I can tell you, the diagnosis of reflux or acid increase is actually one of the missed diagnoses of our world. Research shows, labs can prove that most people do not have too much acid, they have too low. The actual medical condition is called hypochlorhydria. And what happens is your food goes into your body, you have low stomach acid, and so you don't reflux the acid, you reflux the food you can't digest. And when we age, we lose that acid. It naturally gets lower and lower, so this is something that tends to happen with certain patients as we get older. It associates with thyroid disease, it associates with autoimmune disease, there's all sorts of problems that tend to lead to it. And it's something that needs to be addressed properly, not by reducing your acid, but by getting your body to start making its own and raise your acid levels again. Category 4. This is small intestine. Now, 90% of your food is assimilated or digested in the small intestine. If it's not working right, if you have any 1s, 2s, or 3s in category 4, there's no way you can break down food and turn it into energy for your body to heal. It's not going to happen. Who still has their gallbladder? Or who's had their gallbladder removed? Okay. So category 5, if we look at category 5, this is liver and gallbladder. And, you know, I'm not going to put you on the spot because I know you haven't finished the form, but if when you look at that yourself later, look and see if you have any 1s, 2s, or 3s in that section. Because I see this all the time, and it's really crazy because, you know, the liver is incredibly important for metabolic function. And if we look at the section, the liver, the common bile duct, and the gallbladder are all connected. They're really one big piece of detoxification. Thyroid conversion occurs here. B12 methylation, that's where B12 gets turned on, is here. Hormone production and elimination occurs with the liver. Proteins are made here, carbohydrates are metabolized here, fats are digested here. You know, think how important the liver and gallbladder is for proper weight loss. This is a key area for us. And if we talk about patients who have the gallbladder removed, there's a good bet that they still have symptoms in this category. And it's kind of the genius of medicine. So we can take something out and you're still going to have symptoms related to it. When we talk about back surgery as an example, you know, 50% of all back surgeries are failures. Now let's talk about cancer, something that, again, you know, through my fellowship training, we talk about there's no new chemotherapy in the last 50 years. It's the same drugs, slight little modifications of it. If we look at the statistics that show how things have changed, maybe we've gotten 5–10% improved as far as mortality rates. I mean, we're not seeing an improvement at all. Yet we're still doing the same treatments, we're still doing the same surgeries. The outcomes, you know, ovarian cancer is one of the worst, and you know, we're talking about a 0.8% improvement over the past 30 years in the outcomes of ovarian cancer. 0.8%. Yet we talk about all these horrible treatments that we do for patients that make them feel horrible, and there's not going to be any increase in the outcome in so many of them. So you got to look at medicine. You got to say, hey, is medicine working? Or, you know, really, there may only be one good thing about insurance. I really believe this, guys. It keeps incompetent doctors in business. None of you go to your doctors because they're good. You're still struggling with your health problems. If you went to them because you were good, you wouldn't be here. You go to them because your insurance covers him, because he's in your plan. If you want to get better, there's really only one thing that matters. I want you all to write this down. This is the biggest thing you need to write down tonight. Results. That's all that matters, and none of you are getting any. So, as we're talking about how we're getting your results, it starts with looking at what's causing your dysfunction. These first 5 categories we looked at, the colon, the stomach, the small intestine, and the liver gallbladder, they're all part of a big section. We call it the gut. And I'm going to circle all 5 of them. We're going to just write the gut next to it, the gastrointestinal tract. When we talk about your gut, an interesting stat, 70 to 80% of your immune system is actually located in your gut. So if we have 1, 2s, and 3s in our gut, in categories 1 through 5, we actually have an immune problem. And I can tell you, if we have an immune problem, even if we don't have a lot of things circled on these categories, we have a problem with our gastrointestinal tract because our immune system is based there. Now, there's a poor gut connection. There's a huge connection between poor gut function between the gut and the brain. Even Hippocrates, you go back to the father of medicine, said look to the gut, you'll find the cause of almost all human illness. Specifically, if we talk about what happens in the gut, anything that triggers inflammation, Anything that creates a response, you're going to have this immune reaction, inflammation is going to be made, and it's going to go elsewhere. What we're talking about are food sensitivities. I touched on earlier gluten as an issue. Specifically with gluten sensitivity, we have to talk specifically about the increase that we've seen. And what they say is with celiac disease, 87% of celiacs have no GI symptoms. So the vast majority of people who have a problem that is diagnosed as celiac eventually had no idea they had that issue at all. I can tell you there's a direct link between autoimmune disease and gluten sensitivity. Hashimoto's, which is autoimmune thyroid disease, has a direct correlation. Even T4, if any of you take a thyroid medication, cutting out gluten, whether you have a reaction to it or not, will improve your T4 synthesis by 40%. So you're talking less medication needed just by making that one change. How about chronic infections? Parasites, yeast, fungus. I mean, these things are huge issues. If we talk about mold, fungus, yeast, viruses, there's normally 4, possibly 5 things that I see when I'm talking about the gut that are always associated with it. Food sensitivities are always at the top of the list. They always are. You got to look at gluten. You got to look at dairy. You got to look at soy, egg, yeast. How about grains? Corn, rice, protein. How about millet, buckwheat, quinoa? Now the key thing, even coffee, for some people. And here's the thing. You may not have an issue with many of these foods. You may not have an issue with all of them. You may have an issue with only one of them. But if you don't know which that one is and you eat it, and you consume it, then it's causing your immune system to attack your body, and it's going to break down and you're never going to lose weight. Gut infections are something we have to look for. And again, like I said before, you talk about going out, Lake Norman, Lake Wiley, I mean, these are not clean lakes. They're lakes, but if your immune system's compromised, if you're not healthy, don't drink the water. Sushi is another thing. We're told, sushi's healthy for you, but again, it's raw fish. It's raw meat. So if you have an immune problem, you got to tackle parasites. These are issues that we have to look for. And if you have that, you have to get rid of it. You have to identify it. And proper testing allows us to figure out what you have. We've talked about the stomach acid levels. It's a huge thing that we see being too low. We talk there's a condition called leaky gut syndrome. And when we talk about leaky gut, and we talk about all these different problems, what really happens for you from a weight loss point of view is you get a GI problem. It leads to inflammation. That inflammation actually will increase your stress response. It causes cortisol, which is made in the adrenal gland, to go up. That actually leads to insulin resistance. Insulin resistance leads directly to obesity. So everything starts in the gut. It may be an immune reaction. It may be an inflammatory reaction. It may be an insulin resistance reaction. The end result is the same. You gain weight and you don't lose it. If we're looking at categories 6 and 7, this is blood sugar. Optimal functioning blood sugar for everybody is 85 to 99. If it gets too low, it's going to kill nerves in your feet, in your brain, all over. We don't want that to happen. If we're going to get you better, we have to look at your blood sugar. Now here's the thing. High blood sugar is what we always hear about. Insulin resistance if it's at 100 to 126, diabetes if it's at 127 or higher. But high blood sugar and low blood sugar are both problems that we see. I actually tend to see more people have what's called hypoglycemia, reactive hypoglycemia, that low blood sugar, than actually diabetes. But hypoglycemia will always lead to diabetes because what happens is this is what your sugar does. And at a certain point, it's just going to do this, and the bar is going to be raised higher and higher. When we eat food, your body makes insulin. When your body makes insulin, if it makes too much of it, the cells are going to resist that insulin. And then it's going to store sugar as fat. And then we feel tired, and we're hungry. That's why a lot of times when you eat a big meal, you're tired afterwards. When that happens, you know what happens is you then store that fat and you develop insulin resistance, and then you're going to go eat more food, you're going to make more insulin, it's going to resist more insulin. It's just endless cycle. It never stops. And by the way, sugar is required for life. Our brain needs sugar and oxygen to live. It's a primary fuel source. So if we have poor blood sugar regulation, we're going to have poor brain function. Category 8 is the adrenal glands. It's actually category 8 and 9. Now, when we talk about the adrenal glands, there are 2 little glands that sit on top of the kidneys. They release cortisol and other hormones in response to stress. When cortisol goes up, You know what actually happens? There's a direct correlation between the brain and the adrenals. You get memory loss. That hippocampus gets activated. And you know what else? Glucose goes up. And then insulin goes up. And then we store fat. So you're seeing an adrenal stress response. Now, when your body is in an acute stressor, what's going to happen is your body's going to fight the infection, or excuse me, it's going to fight the stressor, it's going to react, it's going to give you the energy you need to deal with it, then it's going to calm down. But when that stressor becomes chronic, that's when you get that insulin resistance and that weight gain. Now we talked about your brain impacted from adrenal stress. I see a lot of people where what actually happens is their cortisol is not high, it's actually low, because they've been under so much stress for so long, the body just loses the ability to make it. Cortisol actually sets your sleep cycle. So if any of you have trouble sleeping, you have to look at the adrenals. And you know, we've got this natural rhythm throughout the day. It's actually inversely proportional to melatonin. And that sets our sleep cycle. It gets us in the morning. It's what pushes us out of bed. You know, your take on the day. And then at night, it's what allows you to fall into that nice, restful sleep. Most fat burning also occurs in that deep sleep. And we're talking about right here. And so if we have a problem with sleeping, we're not burning fat. The adrenals also release epinephrine and norepinephrine. These two hormones actually stimulate pain fibers. And again, so stress can directly lead to how you feel. Now, we're all at risk. I don't care if you're retired and life is great, if you're young and single, or if you're a mother of 4 who's taking care of the household. We all have different stressors on our life, and the key thing becomes, what is our body doing to be able to respond to those stressors? Category 10 and 11. These are big ones for all of you. Well, they're all big, but the thyroid is category 10 and 11. Now, 10 is low thyroid, 11 is high thyroid, and believe it or not, you can have symptoms of both. So if you have any 1s, 2s, or 3s in these two categories, your thyroid's not functioning properly. If your thyroid isn't functioning, you have a bad brain. If you have a bad brain, you have a bad thyroid. Either problem can lead to decreased metabolism and weight gain. This is a huge area we look at. Now, every cell in the body has thyroid receptors. Every single cell that's out there, the thyroid is affected. You can't go anywhere without seeing it. You talk about bone, immune system, the brain, nervous system, those peripheral nerves. How about your adrenals and ovaries? How about GI function, liver and gallbladder, growth, sex hormones, fat burning, insulin, glucose metabolism? If you are diabetic, you have a thyroid problem. 100% correlation. If you're thyroid, you're not diabetic, obviously. It doesn't always go both ways, but you're heading that way. Because it impacts, if you have a problem with your thyroid, it impacts your blood sugar. Cholesterol levels can be affected by your thyroid. How about stomach acid? We talked about that. So every cell in your body has these thyroid receptors, and if it's not working right, it's going to impact everything. There's also a correlation, and this is an important one. So if we talk about hormonal involvement, there's a part of our body called the pituitary gland. And there's actually something above that called the hypothalamus that's actually in the brain. The HP axis, the hypothalamus pituitary axis, controls all your hormones. Controls your thyroid, controls cortisol, controls your estrogen, testosterone, progesterone levels. How about your menstrual cycle, LH, FSH? All these areas are controlled by one area. So if you have a problem with one, it leads to a problem with the rest. Menopause can trigger a problem with your thyroid. How about pregnancy can trigger a problem with your thyroid? And everything can correlate because of how it's regulated. Categories 14 through 17 are our hormones. We're going to look at categories 16 and 17. 16 would be cycling females, 17 would be menopausal females. We're talking about infertility issues, menstrual cycle problems. Somebody comes in, they're menopausal for 15 years, but they still have hot flashes every day. Something is not working right with their hormones, and it needs to be identified properly, and it needs to be fixed. And the number one thing we look at, and we talk about with weight gain, with insulin resistance, blood sugar. That's a huge area that we look. How about adrenal involvement? So what happens with our adrenals and our hormones is we get fatigued, we get stressed. So our body is going to steal hormones from estrogen to make more cortisol. But we're still stressed, so it's not enough. So what happens is our body decides to steal from Peter to pay Paul, but Paul has a gambling problem. And the end result is all of our hormones get depressed. None of it works, and we just get tireder and tireder. But instead of just having a cortisol sleep issue, we also have an estrogen testosterone issue and a progesterone issue. and we just feel worse and worse, and our metabolism slows down. Your thyroid gets involved. Your brain gets involved. All these different things, that HP axis, are involved in causing hormonal problems. If we're looking at where your problems are coming from, this metabolic assessment form gives me a great bit of information as far as where your triggers are. What's your web of physiological dysfunction? You know, there's no secrets to fat loss. It's about untangling your web. You know, what's causing your problems? If we're going to lose weight, you have to eat right. When I say eat right, I don't mean eat the pyramid. I mean eat what your body wants to eat. What sensitivities do you have? What kind of diet is going to be the right diet for you for the rest of your life, not for the next 20 days? You need to exercise. We know exercise is key. Most of my patients do not increase their exercise and still see weight loss going through improvements in the other systems in their health. If your physiology is working correct, your body's going to work better. But if any of those are missing, weight loss, it's a lot more difficult. You struggle. You know, your physiology, your metabolic function, what's inside you, really does indicate how well a diet or exercise is going to work for you. If we're going to find out what's wrong with you, how your physiology is functioning, we have to run the right tests. And you know, that brings up a good point, because you've had tests done before. And how many of you have been told your lab tests were all normal? Yeah, sure. Talk about thyroid is a great example, then we'll touch on that one, okay? So the doctor said there's nothing wrong with me. Why do we not lose weight? Why do we feel so lousy? The answer for that is twofold. One, your docs aren't running the right tests. They run the bare minimum tests that insurance covers, and when you run the bare minimum tests, what do you get? The bare minimum results. Number two, and just on that point, insurance will pay for whatever test the doctor orders. It's all about coding. If I think that you have a thyroid problem, I can say that. If you don't have it, I can't say it again. But to order that full panel, they're going to pay for it every single time. The reason they don't has to do with standard of care. It has to do with these guidelines that they have, because all they're looking to do is put you on a hormone. They're not looking to get you better. And if they're not, and if that test doesn't help them put you on a hormone, what justification do they have for running it? The other big problem that we see is they use traditional lab ranges. Now this is a key thing, because I use the same labs your doctors do. Quest, Solstice, LabCorp, you know, but when I get those results back, the reference ranges that come back from them, those reference ranges have nothing to do with where you should be. They're not healthy or normal levels. So what happens is, who gets blood work done on, let's say, if you went every month to get blood work, are you healthy? No, of course not. You're a sick person. That's a statistic, okay? So if you go every 2 months, there's still something wrong with you. You have to go frequently for blood work. If you go every year, you may be somebody who's proactive about their health and wants a physical. You may have a problem and it's never been identified. So all these statistics go into this big bell curve, and then that's where our reference ranges come from. They're pathological models. It's based on an unhealthy population. So when you get a lab work that comes back, you know, and if it's here, the lab low or lab high, you know, then there's something that's definitely wrong with you, because you are sicker than the population that they're looking at. But if you're within that functional, or that should say that normal range, that lab range, you know, congratulations, you're as healthy as everybody who's sick. We just don't know what's wrong with you, because they're too broad. That's why doctors will say borderline, or better yet, they'll say, well, I see a little something, I'm going to test it again in 6 months, and they will ignore it, because it's not sick enough for you to have a diagnosed disease. But yet you still feel horrible, and I can tell you, if we looked at the functional lab ranges, these are narrower ranges that we use, it's this area right in the middle. If you're not there, something's wrong with you. By the way, those ranges are published in the medical literature. One organization, the American Association of Clinical Chemists, the Endocrine Society, big endocrine group, even that's a crazy one. You talk about TSH, okay? Thyroid test. TSH should be between 1.8, write this down, 1.8 and 3.0. This is normal. This is functional. This is healthy. If your TSH is not between 1.8 and 3.0, something is wrong. Most labs have a range of 0.4 to 4.5. It's a much broader range. And all the time you'll see doctors that'll say you're 4.2, you're 4.1. You know, it's a little high, I'm just going to watch it. The American Association of Clinical Endocrinologists, which is an endocrine group with over 8,000 U.S. endocrinologists, in 2003 established a new guideline. TSH should be 0.3 to 3.14. Well, that range is a heck of a lot lower than the lab range. And it's also a lot more inclined with the high end of what the functional research has shown. So if you're 3.15, if you're 3.6, if you're 3.9, if you're 4.2, you're hypothyroid, even if it's not showing up in the lab range, because that's what the research shows. You have to look at your labs, and it's not just TSH, it's all your tests through functional eyes. You need to have somebody who knows how to evaluate them properly. You guys have had tests done and they've said everything's fine. If I look at those same tests, we're going to be able to compare them to the published ranges and see where are they compared to where they should be. Many times we're going to find that they're not where they should be, and that's why you have these problems. We're going to see patterns of dysfunction that are showing up. That's the reality. So if you want to see normal, bring your lawn chair to the next big public festival. Sit down and see all the unhealthy people that are sitting around you eating their cotton candy and popcorn, right? That's the new American normal. I don't want any of you to be normal. I want you all to be healthy. So we have to look at where the optimal ranges are. Now, all this web, it's pretty daunting. It's confusing. There is an order to this chaos. There are certain things I have to fix if I'm going to get you better. If I don't address these problems, then you're going to continue to have weight issues and your metabolism is going to continue to be slower than we want it to be. The first thing we have to look at with all of you, do you have an autoimmune problem? Do you have an autoimmune reaction or a disease? It could be thyroid, it could be gut, it could be pernicious anemia, it could be nerves, it could be something that's been diagnosed before. You may be on 25 supplements and nothing seems to work right. That's a clue that you may have an autoimmune disease. Your body just won't respond the way everybody else says it should respond. Blood sugar. We've talked about that a lot with insulin resistance and weight gain. It's the #1 stressor in your body. It can lead to thyroid problems, heart problems, nerve problems, weight gain. It's a huge thing we have to identify and we have to fix. Anemia. Now when I say anemia, I don't mean iron. Well, maybe a little, but not primarily. When I say iron, what I mean is red blood cell dysfunction. Your red blood cells aren't working properly. It could be because of an iron problem. It could be because of a B6 or B12 problem. There's something called pernicious anemia. There's actually 32 types of anemias, believe it or not. And they all show up differently and they lead from different causes and have different treatments associated with them. So anemia is huge though, because if you have an anemia, then all your hormones and nutrients can't get from point A to point B in your body properly. And you're going to have decreased function. How about inflammation? So I'm going to take a blowtorch, and I'm going to set it right next to you, and I'm going to light it right on your arm. How's that going to feel? Not very good. That's what homocysteine and C-reactive protein do in your body. These are two markers that we have to look for. And when they're elevated, it means you have inflammation inside of you. That inflammation is an immune response, and it damages everything from your hands and knees to your thyroid and stomach. It causes problems. How about gut function? We talked about 80% of your immune system is in your gut. If you have an immune system problem, what type is it? We know that your gut's is it a food sensitivity? Is it gluten or dairy? Is it soy or corn or egg? Or coffee or yeast? Is it an infection? Is it stomach acid? Is it leaky gut? All of these things are things we have to look for. Your thyroid obviously is a key thing we have to look at closely. I don't just mean running a TSH. We have to do the full functional panel. There are between 8 and 10 tests that I run on every thyroid patient. And most of those tests I run every time. And you know what? If you have to pay cash, it's like a $35 test. It's not that expensive for all of them either. And that's the thing, is these tests are not, some of them, there's a few more dollars for some of the specialized immune panels, but most of them are incredibly affordable based on the information they give us. They tell me so much as to how your body is functioning. How about fatty acid metabolism, lipids, your cholesterol, your triglycerides? How about vitamin D? These things are key areas for us to look at to see how your body's functioning. Now, what I do differently in my functional medicine practice is I run some of the standard tests. I run what I call a Chem 70. You may have heard of a Chem 24, which is what your doctors may run as a wellness physical or as a advanced physical. Complete metabolic panel, a CBC with differential, lipids, but I do a lot of specialized tests. We're going to look at full thyroid panel, vitamin D, we're going to look at B12, folic acid, iron, ferritin, homocysteine, C-reactive protein, those inflammatory markers. We're going to look at leaky gut. It's an intestinal permeability test. We're going to look at your adrenals. You have sleep problems, you have to look at cortisol. The only way to effectively do that is through a saliva test you do at home. If you draw blood, it's going to tell me if you have cancer or not. I don't think you have cancer if you have a sleep problem. They don't correlate automatically. You may, I doubt it though. But if we talk about it, if you have cortisol that's in that normal huge range, well, okay, why do I still have a sleep issue? It's because you got to look at cortisol throughout the day. It should be high in the morning, low at night. And if it's not, if this is you or if this is you, then that's why you have trouble sleeping. That's why your body's not working right. We need to look at your hormones and correlate them. I do that all in the saliva test. I look at all three estrogens, progesterone, testosterone, DHEA. All those hormone tests we look at once. It's a great, great way to assess those two systems. We got to look at food sensitivities. This is important because, again, if you have a sensitivity to one food, every time you eat that food, your inflammation's going up, your immune system's attacking your body. You're not going to lose weight, you're going to feel bloated, and your body's going to break down. If you have an infection, we got to look for it. This functional medicine workup with the right tests is a large part of what we do, but we have to look at your brain as well. We do a functional neurology workup. I do a full examination. We've got to talk about blood sugar regulation, insulin resistance, cortisol, inflammation, fatty acid metabolism. All these different things affect your brain function. So if you have brain function, it can lead to obesity because your brain can misfire, causing an increase in hormonal issues, an increase in obesity issues, insulin resistance. It's just endless cycle. And of course, I'm sure nobody's evaluated your brain because of your weight. You know, we need to, because you would be surprised at how many people that correlates with. By looking at the whole you, it gives me the information that I need to be able to help you accomplish your health goals. To not just lose the weight in January, but to keep it off for the rest of your life and have that lifestyle that you can maintain, to have more energy and have the you that you want. And when I started, I said I had 3 goals. The biggest goal was to reinvent your life. Hopefully, I've done that with the information that I've given you. I want you guys to keep in mind, though, just having that knowledge alone doesn't do anything. Knowledge requires action if you want to get results. I want you guys to ask yourself, what can improve in your health if you decide to make an appointment with me tonight? If you decide to do something about your metabolic health, to address your weight from a whole body perspective. More importantly, I want you to ask yourself, if you decide not to do anything, if you decide to fill out this paperwork and look at it and say, I've got all these 1s, 2s, and 3s, and I've got all these health issues, but I'm going to ignore them. Where do you see yourself in 3 years or 5 years? Do you see yourself next January coming back trying to find another solution? If we fix what we talked about tonight, my job is to help give you that exit strategy that you can maintain for the rest of your life. If you like what you heard, I can sit up here all night and preach. You know, I can definitely talk and educate you guys, but I want you guys to really know what you need to do. The most important thing is you need to make an appointment. My staff can definitely help you with that. That appointment, we're going to do a full neurological examination. We're going to do a full case review. If you've been to the doctor, I'm going to get all those labs they've had done. I have patients that will literally bring in a binder. Their life is a wreck. You know, it was like one day, it just everything fell apart. Autoimmune diseases got them. And I will review their entire history before I meet with them. If you have never had labs done, we'll run them for the first time. The goal is to evaluate and figure out where your health is. If you have a history, have the docs been looking at the right direction, or they've been doing nothing they should be doing? We'll figure out what we have to do. I would like your spouse or significant other at the exam. It's not required. I do want them at the report of findings, because we need to talk about what we found wrong and what we're going to do to actually get it fixed. I usually only accept 5 new weight loss clients per month into our program. And we've got several different conditions that we treat, our thyroid program, our cancer program, so I can only be able to see so many patients at a time to give you the kind of care that you need. That being said, my first 2 visits usually cost $450. That's for almost 2.5 hours of my time. Because you guys came here tonight, I discount that down to $60 reservation fee. That same 2.5 hours you're going to get, that same full evaluation, I give you a discount because, quite frankly, you make my life a lot easier by coming here and listening to me talk. So it means when we get in there and we talk about your problems, we can actually use the time to get you better, to figure out a plan for what we have to do. With that being said, I thank you very much. My staff can definitely help you guys up front. I have a quick minute. I can definitely help. Stay around for just a minute for generic questions. But I look forward to meeting with everyone. Thank you very much.